Hello friends, I am Dr. Kanika Sharma from Dharamshila Narayana Super Speciality Hospital. The month of April is observed as Head and Neck Cancer Awareness Month. There has been a steady rise in head and neck cancers globally. If we talk of our country particularly, in the last 6 to 7 years, there has been almost 116% rise in head and neck cancers. The situation is such that we are contributing to almost 55 to 60% of the head and neck cancer burden globally. So it is important to understand what are these cancers and what we can do to safeguard ourselves and to detect them early. Any cancer which is coming from the voice box, mouth, throat region is called head and neck cancers. Also, the cancers of salivary glands and thyroid is also clubbed as a head and neck cancer. Head and neck cancers have symptoms which may appear very much like any other throat infection. So majorly, if you call what could be the symptoms, would be difficulty in swallowing, difficulty in chewing, maybe somebody who was taking solid food suddenly is unable to take that food and your diet is becoming more towards semi-solids and liquids. There's a change in voice, there's hoarseness in voice, there is nagging cough, if there are some mouth ulcers which are not healing. If there is some sharp tooth which is impinging upon your cheek and causing cuts there, that can also be a predisposing factor for oral cavity cancers. When there are white patches or red patches in the mouth, they can also be indicating that there is something precancerous. That means cancer has not developed, but it might go and convert into a cancer if not attended to. So these are the major signs and symptoms of head and neck cancers. Apart from the mouth complaints, sometimes there may be swelling in the neck region. We call them lymph nodes. They can be below your chin region, they can be in the neck region or above the collarbones. These can also sometimes be an indicative of underlying head and neck cancer. The major cause of head and neck cancer is tobacco consumption. Tobacco in any form can contribute to head and neck cancers, be it chewed tobacco, which is a common thing in our country, or smoked tobacco. All these contribute to head and neck cancers. Rather, they are contributing to any cancer of our entire aerodigestive tract. So, apart from tobacco, we can say spicy food, any sepsis in the mouth, any sharp irritating tooth, as I already told you, can also predispose to cancer. And some viruses like the human papilloma virus and the Epstein virus have also been implicated in causation of many oral and nasopharyngeal cancers. So how we can pick them up early? First of all, we all should make it a habit that once we are brushing our teeth and keep making our oral hygiene efforts, we should examine our mouth. We should check if there is something in our mouth which was not there previously, particularly some white patches or red patches or any ulcers which are not healing. You should seek a healthcare opinion to exclude that it is not cancer. Second thing, if any symptom, the symptoms which I elaborated, if they are persisting, even your medical attention is not helping you get rid of these symptoms for more than a week or 10 days, then you should seek second opinion with regards to exclusion of cancer in your situation. Now, if somebody does get cancer, then what next? So if there is a cancer, then the treatment would be dictated by what is the stage of tumor. So we would conduct certain tests like CT scans, MRI, or sometimes PET CT scan to know what is the stage of cancer. The stage as well as the site of tumor will dictate the treatment. Majorly, the tumors of the mouth region like the tongue, the oral cavity, the palate, they are treated by surgery. And as per the findings of the surgery specimen, you might require further treatment to reduce the risk of disease coming back. If the tumor is slightly advanced or it is not in the oral cavity, rather in the voice box or the oropharyngeal region, then radiation may be a primary modality of treatment combined with chemotherapy. By and large, first stage tumors are treated by single modality treatment, either surgery or radiation, whereas as the disease proceeds to stage 3 onwards, all modalities of treatment are required. Results understandably are better for early stage cancers, and as the stage progresses, the chances of disease being cured go down. So it is important that you become aware of this particular condition and try not to use these fancy tobacco related products to reduce your risks of developing these cancers. Stay safe, be happy, and be very, very careful about your health. Thank you so much.